Namaste. I am Dr. Mallinath, orthopedic surgeon working in Manipal Hospital. Today I will talk on one of the most common orthopedic surgery, most successful orthopedic surgery, that is total hip replacement. Hip is a ball and socket joint. It allows us to move our legs and bend and straighten our body. Osteoarthritis, a type of arthritis, is the main reason for hip replacement surgery. Other conditions, including trauma, may also cause the need for hip replacement. Arthritis is a progressive and degenerative disease that causes joint pain, stiffness, and swelling. It affects the cartilage in the hip joint. Cartilage is a very tough, shock absorbing material that covers the ends of many of our bones. The cartilage forms a smooth surface and allows the bones in our joints to glide easily during motion. Arthritis causes the cartilage to wear away. Loss of the protective cartilage can cause painful bone on bone rubbing. This bone on bone rubbing causes the pain. While the symptoms of hip arthritis are tolerable with the medications and lifestyle adjustments, there may be a time when surgical treatment is necessary. Hip replacement surgery, also called hip arthroplasty, involves the removing the damaged portion of the hip and replacing it with the artificial implants called prosthetics. These devices are replacement for a natural joint, allow pain-free movement. Coming to the causes, already I discussed about arthritis little bit. Arthritis is a major cause of joint pain, stiffness, and swelling in the joint. Arthritis can occur for many reasons, including aging, wear and tear, injury, disease, developmental abnormalities of the hip structure. There are over 100 different types of arthritis: osteoarthritis, post-traumatic arthritis, rheumatoid arthritis, ankylosing spondylitis, arthritis secondary to avascular necrosis. There are so many different types of arthritis are there. Osteoarthritis is the most common type of arthritis, which typically develops as people grow older. Osteoarthritis can result from overuse of the hip during sports or work. Post-traumatic arthritis can develop in individuals of all ages after hip injury, such as fracture of the hip socket. In our country, osteoarthritis is not that common. Rheumatoid arthritis is one of the most serious and disabling types of arthritis. Rheumatoid arthritis can affect people of all ages, but most frequently occurs in women and those over the age of 30. It is a long-lasting autoimmune disease that causes the synovial membrane to become inflamed. This damages the articular cartilage and leads to pain and stiffness. Traumatic arthritis can develop after severe hip injury. A hip fracture can cause a condition called avascular necrosis. This medical condition causes lack of blood flow to the femoral head and leads to bone and tissue death. Avascular necrosis can cause articular cartilage damage, resulting in hip pain and stiffness. Symptoms of hip arthritis. The main symptoms of a severe hip arthritis is dull aching pain. You may feel pain in your hip area, groin, thigh, buttock, and sometimes in the knee. The pain may occur while you are moving or resting. It may even keep you awake at night. Your hip may feel stiff. You have difficulty in moving or lifting your leg. Your hip pain may eventually limit your everyday activities, including walking, style climbing, and bending. Medications and physical therapy may provide relief from the pain of a severe hip arthritis. Coming to the diagnosis of hip arthritis. We can diagnose arthritis by conducting a physical examination. You will be asked about your medical history, symptoms, and level of pain. You may be asked to perform simple hip and leg movements to help us assess your muscle strength, joint motion, and hip alignment. Blood tests and other laboratory tests may identify what type of arthritis you have. We'll do X-rays to see the condition of your bones and identify areas of arthritis, bone cysts or bone spurs. Sometimes the tissues that surround the hip joint or the condition of the bones don't show up on the X-rays. In this case, we may advise a magnetic resonance imaging, that is MRI scan of the hip joint. MRI is used to obtain more detailed images. A bone scan identifies location of the abnormal growths in such as arthritis. A bone scan requires that you receive a small harmless injection of a radioactive substance several hours before your test. Substance collects in your bones in areas where bone is breaking down or repairing itself. X-rays, MRI and bone scans are painless tests. However, they require that you may remain very still while the camera takes pictures. Coming to the treatment, as your arthritis progresses and becomes more severe, medication, rest, physical therapy may fail to relieve your symptoms. Your pain and immobility may cause you to limit your activities and lifestyle. In such cases, hip replacement is indicated. When non-surgical treatments don't provide relief for your symptoms, then only the hip replacement. Hip replacement involves removing your damaged joint and replacing it with an artificial one. This is an inpatient procedure. You will most likely be admitted to the hospital one day before the surgery for the investigations. The most common type of anesthesia for the surgery are general anesthesia or spinal anesthesia. The general anesthesia will put you to sleep. The spinal anesthesia will numb your body from the waist down while you remain awake but sedated, so your memory is blurred. We will help you to decide which anesthesia is best for you. You may also be required to donate blood after admission. Any of your relatives or friends can donate it. But nowadays, blood transfusion is rarely done. Only if there is a deficiency or if your hemoglobin is low, in such cases, blood transfusion is required. We will make an incision on side of your hip to open your hip joint. Your hip joint will be opened to allow to remove the damaged bone, cartilage and tissues. The femoral head and cartilage or bone from the hip socket will be removed. Your hip joint will be replaced with an artificial joint. There are variety of artificial joint types and we will choose the most appropriate one for you. Highly polished strong metal ball will be implanted or attached to the top of your femur. A durable socket made up of a plastic or a plastic and metal will be attached to your bone with or without screws or a cement. The artificial joint will allow you to perform most of the pain-free movements that you used to do. Coming to the recovery or post-operative period. You will stay in the hospital for 3 to 4 days following hip replacement and you will receive pain medication to make you as comfortable as possible. And a V-shaped pillow may be placed between your legs to position your hip while it heals. You should sleep with a pillow between your legs for about 6 weeks. Your physician will temporarily restrict certain movements to prevent artificial joint from dislocating. You should refrain from crossing your legs, bending your hips at more than 90-degree angle and pointing your feet inwards. Physical therapy and occupational therapy will begin the day after your surgery. You need to use a walker, cane or crutch while standing and walking. Your physiotherapist will help you with the walking and show you how to go up and down stairs depending upon your ability. You will also learn ways to exercise to strengthen your hip joint. An occupational therapist can show you ways to dress and bath. Your therapist can also recommend durable medical equipment for your home, such as raised toilet seat or a shower chair. The equipment may make it easier for you to take care of yourself as you heal and help to prevent further injury. Now, coming to the success, everybody is bothered, including doctor and patient. If properly done and in properly selected patient, the hip replacement is a very successful surgery. It will last from 10 to 30 years. The success of your surgery will depend in part on how well you follow your instructions during the first few weeks following surgery. You may need help from another person during the first few days at home. If you don't have family members or friends, ask your hospital staff, they will arrange some home care. In many cases, we recommend time in hospital for 1 or 2 days if you have got some difficulties. You should be able to resume light activities soon after your procedure. Total healing can take 3 to 4 months. Overall, the majority of the people experience dramatic reduction in hip pain and gain the ability to resume functional activities after hip replacement. It is important that you adhere to your exercise program and safety precautions when you return home. You may have to change the way to do some activities such as bending to protect your new hip joint. You will be advised to avoid high impact sports such as jogging for the rest of your life. It's very important that you continue with your recommended exercise program. It is important to avoid falling. Your therapist can suggest ways to prevent falls in your home. This may simply mean removing rugs, making sure that you have a walking path free of cords and clutter. You should also continue to use durable medical equipment as advised. For any minor problems, you have to consult your doctor. And you are advised to take early treatment for infection in your body anywhere, dental infection or urinary infection, to prevent spread of infection from the dental or urinary tract or from any part of your body to the hip joint.